people who are struggling with mental health challenges. This as the pandemic has taken a toll on the mental health of many Americans. But there are concerns that the 24-hour hotline may not have enough money to handle the expected surge in calls. Our Samantha-Jo has a story.
This is a Lifeline. How can I help you?
Laura Mayer's work at a crisis call center in Virginia hits close to home.
Are you having any thoughts of suicide today?
When she was 15, her father took his life. A few years later, a close friend committed suicide.
There is nothing in the world that prepares you to lose someone to suicide. It's such a sudden and traumatic experience. In here is our call center.
Now she uses her own experiences to help others in despair.
People could feel that I had a different understanding of what they were going through.
Soon, getting crisis counselors like Mayer on the phone will be easier. Beginning in July, Americans will be able to dial 988 to talk to a mental health counselor through an expansion of the National Suicide Prevention Lifeline. But many call centers are already straining to meet current demand. Once the 988 system officially launches, call volumes are expected to grow. Callers could face delays or be unable to reach a counselor at all.
The level of capacity is a big concern, and I think every community should be concerned.
2 years ago, the system received more than 3.3 million inquiries, but only responded to 85% of calls, 56% of texts, and 30% of online chats, according to a federal report.
We're here to help.
988 comes as suicide rates have increased by a third in 20 years and spiked among young people during the pandemic.
This is really both a transformative opportunity, but also recognizing that it is building on the success of the Lifeline.
The 988 system was authorized by a bill signed 2 years ago. States can impose new taxes on cell phone usage to support it, and that's really similar to how 911 call centers are funded, although only 4 states have moved forward with these kinds of taxes.
It will require federal government, state governments, private payers, public payers. We really need everyone at the table.
This is our virtual call center where all of our crisis workers log in every day.
Mayer says the transition from the Lifeline's 10-digit hotline to 988 will require more than upgrading equipment.
The biggest barriers or challenges we're facing are the training that's required for a broader group of people that are going to be reaching out.
Training more counselors to help with an increase in mental health issues.
Lifeline, what's going on today?
In Washington, Samantha-Jo, Spectrum News.